Most people know GLP-1 peptides because of weight loss. That's how they enter the mainstream conversation for sure. But in the research world, they're now being studied for many other things. And first of all, they've been studied for decades for insulin signaling and diabetes regulation. But now they are entering the conversation for longevity because we noticed that there are impacts on cardiovascular disease outcomes, neurodegeneration like Alzheimer's disease risk, liver disease, kidney disease, and even overall metabolic health and long-term survival. So today I want to talk about microdosing GLP-1 peptides, not from hype, but from biology and longevity perspective, what we know from the research, what we're still learning, and why some people are exploring this low-dose approach as we age, even if weight loss is not the primary goal. Now, when I say microdosing, I'm generally talking about 1/10 of a standard therapeutic dose. It could be 1/5, but significantly less than the therapeutic dose. So this is important because the intent is completely different. At therapeutic doses, GLP-1 peptides are designed to significantly lower appetite, which reduces body weight. This can help treat obesity and type 2 diabetes. At microdose, the goal is not necessarily appetite suppression, although we may get a little bit of food noise reduction, a little bit of appetite suppression, but it's more to gently support our insulin sensitivity that declines with age, improve metabolic signaling, help with inflammation, and help with some of the downstream aging pathways. So you can think of this as working with physiology, not overriding it. One of the most consistent findings in aging research is that insulin sensitivity or insulin signaling becomes less efficient as we age. And most people notice this as extra weight showing up around the middle. And this can happen even in lean individuals or people who exercise. It's very common during perimenopause and menopause. Declining estrogen or changing cortisol patterns means loss of muscle mass sometimes, and these can influence how well our body responds to insulin because muscle is sort of the insulin sensitivity organ. The more muscle we have, the more insulin sensitive we are typically, and that's why those new studies showing that people with larger thighs live longer because it's essentially a way to soak up more of the sugar and the carbohydrates that enter the body. So GLP-1 peptides can improve insulin sensitivity and glucose handling, and this is extremely well studied in the literature. So when we're talking about microdosing for longevity, the hypothesis is not to lower blood sugar excessively. We're asking whether we can support healthier signaling as these pathways naturally decline with age. That's a different question, and it's a much more reasonable one biologically. And I think it fits the experience that many people have into your 40s and 50s of suddenly experiencing this weight gain or inflammation that seems like it comes out of nowhere. You're not making that up. That is your biology. And that's where we can get into this conversation around microdosing, and maybe that can help to support some of these changes that we're seeing. So let's talk about inflammation and neuroinflammation, meaning the brain. So chronic low-grade inflammation, which is sometimes known as inflammation, aging, it's one of the central drivers of aging in general. What we know from GLP-1 that activating this receptor, the GLP-1 receptor, has been shown to actually reduce systemic inflammatory markers. It improves endothelial function. It helps to reduce the inflammatory signaling across multiple tissues. And what's really interesting is that there's a growing research on neuroinflammation. So we actually have GLP-1 receptors in our brain, actually in multiple organs. And GLP-1 based therapies are actively being studied in neurodegenerative diseases such as Parkinson's and Alzheimer's. Now, to be clear, most of the data comes from people that have metabolic disease or established risk. The longer term 20 years of studies that we have are mostly in people with obesity. So we cannot say that microdosing prevents Alzheimer's. However, we can say that metabolic dysfunction and neurodegeneration, those are tightly linked. We do know this. This is well established. That's why I said inflammation is associated with multiple risk of disease. And insulin resistance in the brain is increasingly recognized as a contributor to cognitive decline. You may have heard Alzheimer's referred to as type 3 diabetes for that reason. So supporting metabolic signaling may be one way to support brain resilience over time. Now, another aspect is cardiovascular health. So let's look at that. This is one of the strongest areas of evidence. We have large clinical trials with, again, people with obesity and type 2 diabetes on GLP-1 therapies. And what we've seen is major reductions in adverse cardiovascular events, lower cardiovascular mortality, improved vascular inflammatory markers. And these aren't subtle. These are very robust findings. Now, the important caveat is that we do not know if these same reductions apply to metabolic metabolically healthy individuals that are using microdoses, just to be clear. But we know that aging does increase cardiovascular risk, and insulin resistance, inflammation, and endothelial dysfunction. Those are major contributors to cardiovascular risk. So the longevity question is, can maintaining healthier signaling earlier reduce this cumulative risk over time? Now, that's not proven. That's still being studied, but it's a reasonable hypothesis. It's very grounded in existing biology, and I think it makes a lot of sense. And if you are someone that's over 40 and you're noticing this inflammation, you know what I'm talking about, right? It's just, we're not just making this up. This is something that happens because of our biology, just things slow down. And so does it make sense to utilize some of these tools to help with in the longevity context? And there are actually a lot of clinical trials that are ongoing, actually started this year or late last year, that are asking these questions of whether or not these GLP-1s can impact longevity outcomes, or looking at epigenetic clocks and just other markers of health and disease risk. So that's really fascinating. I'm going to talk about that in a different video, but I wanted to touch on that as well. Then let's talk about liver and kidney health. So GLP-1 therapies have also been shown to have benefits in non-alcoholic fatty liver disease, improving kidney function in high-risk populations for kidney disease. And again, these benefits, they do appear to stem from improving insulin sensitivity, reducing inflammation, improving metabolic efficiency. So for healthy adults, this isn't about treating disease, it's more about supporting organs that are highly sensitive to metabolic stress over many decades. Again, kind of goes back to, we know as a population, we are seeing higher rates of obesity, higher rates of diabetes, loss of insulin signaling, more metabolic dysfunction, just as a population in general. And these peptides are improving all of those things. So I think we're in a groundbreaking era where we're going to see massive changes over the next couple of decades in human health because of GLP-1 peptides. I'm very bullish on them, if you can't tell. But my question is whether or not these can also support people who are mostly metabolically healthy, maybe just are starting to see that slight decline and it's showing up as bloating, belly fat, subtle changes, right? Can we improve those populations as well, including myself? Okay, let's dive into body composition and fat distribution, because this is another underappreciated area of aging, where fat is stored, not just how much. So it really matters where the fat is stored. Like, we know that the more visceral fat we have, that atopic fat that's around organs, that's very dangerous for risk factors of disease. It's metabolically active fat. It's not the same as subcutaneous fat. Subcutaneous fat is not all that unhealthy. It's the visceral fat that we really need to be concerned about. Now, of course, most of us have, for vanity reasons, we want to improve the subcutaneous fat as well. But what we're talking about specifically for disease risk is that visceral fat. Now, GLP-1 signaling actually influences nutrient partitioning. So not just appetite, it actually helps our body respond better to the nutrients that it has in its supply. So microdosing might help to maintain healthier patterns of fat storage, especially in midlife when we're battling with hormonal shifts as well, which makes this all even more challenging. Can microdosing improve that as well? And from the early studies that we have, it appears yes, it can, because we are seeing reductions in visceral fat in people that are on these for long term. What about skin and visible aging? How are these impacting that? So skin is strongly influenced by inflammation and vascular health. A lot of the skin conditions are related to inflammation. And if you follow me, you know I preach about gut health because everything starts from the inside. We can do all kinds of stuff to the outside to calm things down. But if we're on fire inside, then it's not really going to resolve that underlying issue. And that issue is stemming from inflammation. And so lowering that systemic inflammation, this can improve metabolic signaling. And then there may be indirect benefits for skin quality, collagen integrity, the overall appearance of the skin, improvements to rosacea and other immune regulated skin conditions like psoriasis, etc. So it's not necessarily like a cosmetic treatment, but again, anything that's showing up on the skin is a direct indication of something that's kind of going wrong inside. And it can be high insulin, which is going to drive that inflammation. It can be gut health. And I think, these peptides are also showing improvements in gut health. So just overall treating the whole system and that system's biology, which is the approach that we really want to be taking. Now let's talk about what we don't know. So the most most of the long-term data comes from people with obesity, with insulin resistance, with metabolic disease, right? Those are the decades-long research that we have. We have 20 years of research now in people taking GLPs for diabetes, right? And that's where a lot of this data is coming from. So we don't have a lot of data on healthy aging populations that may benefit from microdosing GLPs. So just wanted to be clear, we're taking a lot of the information, we're extrapolating from what we have, and I'm just kind of balancing out with what we don't have, right? So the conversation about risk reduction, biologically plausible, but it doesn't guarantee anything. But we do know that people with obesity are seeing massive, massive benefits, not just in relation to reducing obesity risk, but also in relation to all these other things: lowered cancer risk, lower cardiovascular risk, improved kidney and liver health, etc. So are those applicable to populations that maybe aren't obese or aren't diabetic or pre-diabetic? We don't know the answer yet, but we do have a lot of interesting studies that are going on now. So we can extrapolate some information. It makes sense. And many people, including myself, that are utilizing this approach, everybody I talk to is always telling me how much they are shocked by the inflammation reduction. They didn't think it was possible. They are seeing improvements in their skin. The bloating is gone, the belly fat is gone, and just all kinds of wonderful things that are happening. And we do have long-term safety data. So these peptides are relatively safe. There's very few risk factors. The only counterindication is medullary thyroid carcinoma history or risk. Otherwise, they're pretty much safe for most people. And I'm not saying that everybody should be on them. You should obviously consult with a clinician that's trained to assess you, your background, your history, your biomarkers, etc. But I'm trying to say that they do have a lot of benefits that are showing up in the research. So I also want to say that GLP-1 signaling, it does not replace the lifestyle non-negotiables. We still need to be strength training to maintain our lean muscle mass. It's super, super important, because anytime that we're working, especially if we're losing weight, we don't want to be losing muscle, or we want to minimize the loss of muscle. And we have to be training in order to preserve that muscle. We have to be eating enough protein. We have to be getting enough sleep. We have to modulate our stress, have stress reduction practices in place. We want to be eating real food, healthy food. Micronutrients are important. If anything, microdosing only makes sense after all those foundations are in place. It's a tool, but it doesn't replace the foundations. So the takeaway is not that GLP-1 peptides are a longevity miracle. It's just that they're a very powerful metabolic tool. And when used conservatively, thoughtfully, in the right context, this could help support healthier aging. That's how I think about it. And that's how I'm approaching this conversation, cautiously, but very optimistic from what I've personally seen and the women that I talk to on a daily basis. If you like this type of conversation, you want to learn more about longevity and peptides, and follow along, like this video and subscribe to this channel, and I will see you in the next one.